again, I'll keep an eye on the waiting room in case anybody joins us a little bit late. Oh, no problem, Renee. So thank you again, everybody, for joining us this afternoon. My name is Melissa Bogosowski. I'm the program manager for Project Healthy Schools here at the University of Michigan. And hopefully everybody's here to learn more about our program and our partnership with Blue Cross Blue Shield of Michigan. Our partnership with Blue Cross is called Building Healthy Communities, Engaging Middle Schools Through Project Healthy Schools. And we are headed into our 20th year of our program at PHS. So we're really excited to be celebrating that next year. And as we're going through everything today, I'll make sure to provide any updates that we have for next year's program. So again, the BHC PHS is a collaborative effort between Blue Cross Blue Shield of Michigan, U of M's Project Healthy Schools, which is us. We also partner with Wayne State University Center for Health and Community Impact and the United Dairy Industry of Michigan. We have a few other partners that work with us as well that provide additional support to our schools. But our main kind of core group of partners are those four bulleted partners that you'll see on the list on this slide. So I mentioned this once I let everybody in from the waiting room, but copies of slides will be emailed to everybody after this presentation is done. So you don't have to worry about scribbling down notes or anything else like that. This will be sent to everybody following. We have another webinar scheduled for tomorrow morning. And so once tomorrow morning's webinar is done, we'll get these slides sent out to everybody. And again, feel free to use the chat or the Q&A feature on in Zoom throughout the meeting. And again, if I don't get to your question right away, if I'm immersed in my PowerPoint, I will be sure to answer those once I see it or at the end of the presentation. Note the live transcription. You may turn it off if you like by clicking the CC box and then click hide, then choose hide subtitles. And again, this meeting is being recorded. So if you have any colleagues who aren't able to make it today or tomorrow morning, this will be available for anybody who would like to learn more about the program if this afternoon's time or tomorrow morning's time did not work for their schedule. So what we'll cover today, so what is Build a Communities Project Engaging Middle Schools Through Project Healthy Schools, eligibility to apply for PHS, the overview of our program and the 5 steps that each of our schools follow, resources provided to participating schools, expectations of participating schools, how to apply, criteria for school selection, and then key dates and timelines to keep an eye on. Even though this program doesn't start until next fall, there are some dates to be mindful of, especially when it comes to the application and interview process. So again, PHS, so we're a community Michigan medicine collaboration with the goal to improve the present and future health of youth through education, environmental change, and community engagement. And so just to give a little overview and kind of a bird's eye view of where we're at. And so PHS, again, as I mentioned just a minute ago, we are headed into our 20th year of programming. And so we started back in 2004 through Michigan Medicine, the Frankel Cardiovascular Center, through Michigan Medicine, through the support of Dr. Kim Eagle. And so he is still a tremendous supporter as well as the CVC. And through that support and the work that we've been able to do with so many of our partners across the state, we've been able to reach over 150 schools across the state of Michigan. And so we are not limited to any particular geographic area in the state. We want to be in every part of the state. And so if you are in an area that doesn't have our little yellow house in it, that's perfectly fine. Of course, we do have more schools that are kind of in the southeastern Michigan area, but as you can see on the map, we're have a strong presence in the Upper Peninsula, mid-Michigan, and again, we're hoping to branch out into more of those areas of the state that have fewer of those yellow houses. And so again, the goal of ours is to get into every school. And so if you don't see your region dotted, then that's okay. You could be the first school in your area. And so again, and with our programming, we've reached over 120,000 students, which is a huge accomplishment for us, and we hope just to continue to expand and reach more students across the state. So for our program, we have 5 goals that we tailor our program around and the resources that we provide. Our program is evidence-based, and so we have, if anybody is interested in any literature that's been published about the significance and the significant outcomes of our program, I'm happy to provide those. We also work with our evaluation team at Michigan Medicine to provide evaluation data. And we'll get into that and what that looks like on your end in just a few minutes. But we have a sustainable framework. So this is not a one and done program. So our goal is not to come in for 1 year and then hit the road and be done with every school after that. We have a sustainable program to where we're very hands-on for the first 2 years, and then in years 3 and beyond, we kind of switch into more of a wellness grant program, but still provide all those resources and support needed for schools to be successful. So we tell all of our first-year schools that you're with us as long as you want to be with us, and we provide that support from our team to where you get that individualized support from one of our PHS wellness coordinators each step of the way. So with that, our main focus is to focus on chronic disease prevention. And so PHS started as a childhood obesity prevention program. We still focus kind of in that light, but we definitely want to make sure that we're also focusing on other chronic illnesses such as type 2 diabetes, heart disease. We know that those behaviors that students, children, and even teachers and staff, the better behaviors that we can encourage, the healthier behaviors we can encourage, the healthier environments that we can create, set people up for a much healthier future. And that's a big piece of the puzzle when it comes to PHS in our program. And so when we're looking at the goals that we have, we would love for students to eat more fruits and vegetables, choose less sugary food and beverages, eat less fast and fatty foods, be physically active every day, and then spend less time in front of an entertainment screen. We wordsmith that fifth goal a little bit, especially during COVID, because we know screens were inevitable during that time. And so just making sure that students are taking the time away from screens when there are other opportunities for recreation outside of the usual screen time for school or anything else. So as mentioned, us being evidence-based, here are some of the impacts that we have. And so from our schools from 2019 to 2020, and we also have updated numbers that are pretty similar. Students who do participate in Project Healthy Schools, we see an average of a 58% increase in students eating more fruits and vegetables. We see a 52% increase in students being more physically active. 46% of participating students choose less sugary foods and beverages, and 29% spend less time in front of an entertainment screen. And so we are very proud of these outcomes. Of course, we would love for these numbers to always be higher, but considering, all the things that go on in a student's life, things that go on throughout the school day, after school, the things that compete with healthy nutrition, physical activity, screen time, we're very happy with these results, and we consistently see these types of outcomes every year that we're in the program. And so we're really excited to continue this work with your schools, hopefully. So for eligibility, so any public, charter, or private nonprofit school is eligible for BHC PHS program, and schools are able to apply regardless of your free reduced lunch percentage or eligibility. We know that's a little bit different here in Michigan right now with it being free for everybody this year. Geographic location, as I showed on the map, we do not discriminate when it comes to location. The more the better when it comes to the locations that we can serve for schools. And so schools who participate in other health programs are still eligible. And so if you do participate in another community-based program, if you have other curriculum, such as Trails, Michigan Model, those schools, you are still absolutely eligible. We work closely with Michigan Model. We previously worked with Trails, and so we are great supporters and really love their programming. And so if you have that does not disqualify you. We have a really great relationship to be able to enhance and support one another's programs. And so if you have any of those programs or anything else that's health or social emotional learning related, that does not disqualify you. The only exception is if your school has previously participated in a previous Building Healthy Communities program. For middle schools, that would be the Step Up to School Wellness Program. And so that sounds familiar, if your school previously did receive Step Up to School Wellness, unfortunately, because that's another Blue Cross program, schools aren't eligible. If that sounds familiar, feel free to reach out to me and I can get you in contact with their team to make sure you're continuing to get the resources that you need. If Step Up to School Wellness does not sound familiar, awesome. And you're more than likely eligible, but we will make sure to double check with our partners at Blue Cross before we move on to interviews, just to make sure that schools who are eligible will continue on through that process. And then schools must serve students in the 6th, 7th, or 8th grade to be eligible as well. So as long as you have one of those grades in your school, you are eligible to apply to be part of the BHC PHS program. So the 5 steps to school wellness. And so this is kind of what our program looks like. And so we start through step 1 and work our ways up to step 5, and we'll walk through each step, but just to kind of give you an idea. So the program itself is the same, but as we work with each individual school, we know that the needs, the resources that are needed, the staffing that is available, we know that that's different with every school. And so even though the program itself is the same, it starts to look very unique based on every school as we get through the assessments and the early stages of the program. And so we'll go through that in just a minute, but just wanted to give that a heads up where we're not a one size fits all. We definitely focus on the unique needs, whether it comes to education, environment, and resources of every school, knowing that every school has a unique situation, and we want to make sure that we tailor the program so that's the best fit for your school's environment. So one of the first resources that our schools have access to once you are accepted and accept our offer to be part of the PHS program is our PHS portal. And so this is a access only login protected website that all of our schools have access to. And this is where you'll have all of your materials for the lessons. So lesson plans, pre-recorded lesson plans, guidance on those 5 steps that I showed in the last slide, any type of wellness initiative ideas, additional grant support that we have through some of our partners. And we have parent packets, we have community engagement packets, and any other up-to-date news, videos, and announcements, whether it's from our newsletter, some of our other partners. And so again, that is a one-stop shop for all of our schools where you can find all the resources that you need for PHS, as well as where you'll be able to submit any of the reporting that you have to do on those 5 steps. So the first step is to build support. And so the 3 most important pieces of this step is to 1, identify 1 or more wellness champions. 2 is to form a wellness team, and we're highlighting that because of the necessity and the importance that the emphasis that we put on wellness teams, as well as engaging your school community. And so to be part of the PHS program, we ask schools to identify at least 1. Some of our schools have 2 wellness champions, and that's typically a person within your school environment. Many of our schools, it's their health teacher, their gym teacher, social worker, school nurse, someone who is super fired up about health and wellness, someone who is willing to kind of take charge of being kind of our contact person at your school, and they will be the lead of your school's wellness team. But what we don't want to see is to have that one person or those 2 people run the entire program by themselves. And so that's why we highlight the wellness team, because that's just as much of an important component for the success of PHS to be successful and sustainable, is to make sure that your school has an active school wellness team. And so why we emphasize school wellness teams first is because there's tons of research and literature out there that shows that they support healthy students. And so one study that we refer back to often is over 5,000 students from 420 different schools across the country were studied and followed. The more active a school wellness team was, we saw lower BMI scores from K through 12. And we also saw students eating more breakfast on a more frequent basis. And we also saw a statistically significant rate when it came to lower intakes of added sugar, lower energy dense food, and sugar sweetened beverages. And that's just from having an active wellness team at your school. So not anything to do with programming or the curriculum that we teach, just from having that active wellness team, we can start to see some really great health benefits for the students and for staff. But that's why we're here. We want to make sure that we're providing all the resources that we can to support your school. And one big piece of that is to make sure that we're supporting your school's wellness champion and your wellness team. So after we identify your wellness champ, have your wellness team, get the word out to your school community that we're headed your way. We then go through some assessments with your wellness team. I say we're a little bit more assessment heavy on the front end, and so we always tell our schools that ahead of time to where we have our schools go through the Healthy Schools action tool, which is through the Department of Health and Human Services. And so we have our schools go through the HSAT and a lunchroom assessment, and that's just a good kind of baseline to see where our schools are at. And you get all that data. Every school will get their own individual login with the HSAT, so you can go and log in yourself. We encourage to have the work divided with the HSAT because they can be a little bit long. And so what we're really encouraging is to have wellness teams set up some time to walk through this together, or to, again, divide and conquer and have a handful of different people work through a few of the different HSAT assessments that we require our schools to do. And then once the HSAT is completed, we also have a pre-program, pre-implementation health behavior questionnaire for students. That questionnaire is IRB approved through the University of Michigan. All that information is de-identified. And again, it provides us information with a baseline to see the health knowledge, behaviors, and attitudes towards different health behaviors of your students. And then at the end of the program, then we follow with a post-health behavior questionnaire to see if we see any changes, again, in knowledge, attitude, and behaviors when it comes to those particular behaviors that we emphasize in our program. Okay, and so after we work through those assessments, and again, and you will have the support of your PHS wellness coordinator through each one of those steps, through each one of those assessments. If it works better to have your coordinator come and work with your wellness team to walk through that, we're more than happy to do that as well, whether it's over Zoom or coming in person. Again, whatever works best for your team, we're happy to accommodate whatever the best situation is for your school. So our third step is to make an action plan. So based on the results of the HSAT and the health behavior questionnaire, we analyze and assess those results. And then from that, we'll identify some wellness goals that we can set. And so maybe your school lunchroom is rocking and rolling, and that's going really well, but we can focus on some opportunities for physical activity, versus another school where maybe they have plenty of opportunities for physical activity, but we see that staff wellness needs some support. And that's where this third step starts to make the program very unique in each school, because we'll tailor the wellness goals based on the outcomes of the assessments of each school. So then after we create those goals and their school wellness improvement plan, we then take action, and that's when we start to implement our curriculum. And so we have 10 lessons through Project Healthy Schools, and you'll see a list of some of the topics in the next slide, as well as social emotional lessons. And so put a little star there, or a little asterisk there. So we, as I mentioned previously, partner with Michigan Model for Health. And so if your school does not have a comprehensive social emotional health curriculum, Michigan Model for Health has been kind enough to partner with us and offer that curriculum and training for free to all of our PHS participating schools. If you do have a evidence-based comprehensive SEL program that you're already implementing, something like Trails, or if you're already using Michigan Model, I know there's a few others, we will not require you to also implement another SEL curriculum. But we do require some SEL curriculum to be implemented in step with ours, just to make sure that we're addressing both the physical and the social, emotional, and mental health of our students, because we know both are just as important. But again, if you guys are already, if your school's already cruising along with SEL curriculum, we'll just want to know which curriculum that is, so we can report that to our partners. But again, you will not have to go through training for Michigan Model if you already have a consistent evidence-based program. If you don't have anything, that's where Michigan Model can be really helpful, and again, completely free for your school. This entire program is at zero cost to your school. We say the biggest cost is time, and we know that's very valuable as well. But just to know, if you have to take this information back to any administration, just know that this is zero cost to your school for as long as your school wants to be part of our program. And so with that cost and with the funding that you're provided, we provide all the resources for lesson plans and activities, as well as funding to implement those different wellness initiatives for your school based on the goals that you set from your school wellness improvement plan. So all of our lessons are available online. So all the curriculum, PowerPoints, those are all on our portal. We have where you can teach them traditionally in the classroom, but we also have them recorded. We did that in response to COVID. So if there's any point where maybe lesson 5, it's just hard to squeeze it in because of testing or something else that's going on, you can just upload that and pull that up and have that be a supplemental resource. All of our curriculum is also aligned with the Michigan National Health Education Standards. And so if there's any time where you need to pull up the video recording of the lesson, that's all available as well. And so mentioned with social emotional learning, social emotional health. So again, why we emphasize the pairing and making sure that schools have that component as well is just because of we know the benefit that social emotional health and social emotional learning has on students and staff. We know that SEL helps to improve student academic achievement, improves test scores, enhances self-regulation skills. And so with our curriculum, as well as either Michigan Model, Trails, or whoever your school is working with, we just know that's a really great relationship to have. And so that's why we also emphasize the implementation of social emotional lessons. So when we talk about our wellness initiatives, there's a multitude of options that we have. So you can create new signage for your lunchroom. We do a lot of food tastings. We'll show up and do smoothie bars. We'll do fruit and veggie tastings. We can host a salad bar. We can do rewards for healthy behaviors. We've paid for, you also get a stipend for updated PE equipment that's outside of this particular funding. And so you get just your own bucket of funding just to update your school's physical education equipment, on top of then us helping to fund some different wellness initiatives. So then after all is said and done, then again, I mentioned just a few slides back that we have our health behavior questionnaire. And so we implement that again at the end of the program. We also do a post-lesson survey for both the students and the teachers. And then we just ask for our schools to share photos and success stories so that we can, so you all can share your success and then we can share it with our network as well. So just in terms of other resources that we provide as a program. So again, you get your own Project Healthy Schools Wellness Coordinator, where you get that one-to-one support, where they will, again, walk with you through the entire program. So when you sign up and join PHS, we don't just show up and drop a bunch of resources and leave. You will have someone walking through all 5 of those steps with you for the entire school year into year 2, and as long as you want to be with the PHS program. Again, the educational lessons, we provide training for each of those lessons. And so you will be well equipped. Whoever will be teaching those lessons will be well equipped and prepared to teach those versus, again, us just giving you the access to the portal and saying, have fun. We make sure that we walk through everything with your school, whoever will be teaching those lessons so that they feel the most prepared that they can. And then, as I mentioned, again, we provide all the resources, all the materials that you'll need for each of those 10 lessons for PHS. So again, funding, we also provide a small stipend for the wellness champ. We know that it's extra work that you're taking on as a wellness champ. So we do provide a small stipend for your efforts. Again, funding for your wellness team PE equipment and tastings. And then you also will be built into our wellness champion network. Again, we've been in over 150 schools across the state. And so we provide continuing education opportunities. We provide opportunities for sketchies every year. And so we always make sure to provide as much as we can for your school, as well as to make sure that you are all up to date on the most current health and well-being topics for your students and staff. So when it comes to expectations of schools, again, we ask and require all of our schools to have a minimum of 4 wellness team meetings each year. The first being a kickoff where we can go through the training of the program. And again, we're happy to attend and provide support to as many meetings as you would like us to be at. Regular meetings with your PHS wellness coordinator. We provide that technical support for you from start to finish. And again, as I mentioned before, we encourage all wellness team members to help out with the HSAT, makes things go a little bit smoother. And then it has it not take as long for the wellness champ to complete on their own. We also partner with the United Dairy Industry of Michigan. And so we set up that meeting with them and your food service director to take a look at what resources can dairy provide to enhance your school nutrition environment. The 10 educational lessons. And as I mentioned again, making sure that you do have that social emotional curriculum, complete those wellness initiatives, and then, as I mentioned, sharing the success of your program. So how to apply, all this information will be made available to you, and it's now on our website. Review the application, and then you can go apply that. That link is live on our website. So if you just go to projecthealthyschools.org, you'll see our Apply Now page. Complete the application. We'll receive the application, and then we will reach out to schedule an interview with your wellness champion and one administrator from your school. And applications are due by June 30th. So you've got some time, but we know that the school year will wind down very quickly, and do not blame y'all for wanting to shut the laptops at the end of the school year. And so we, ask to have those applications in by June 30th. Okay, and then tips for a competitive application: just make sure it's complete. Share the level of commitment from administration and staff. Identify which class that you will have PHS being taught in. Identify those wellness champions, as well as identifying some of those wellness team members, as well as the level of commitment that your school will have. Okay, and so again, biggest kind of date to remember is June 30th. That's just when applications are due by. The sooner you can get that in, the better. Then we can set up that interview after we get your application. And then we will have those interviews and then announce awards at the end by August at the latest. Okay, so I know that's a lot of information in less than 30 minutes. And so again, this will be recorded, but wanted to go ahead and pause. I know we're running out of time, but wanted to pause and see if anybody has any questions for me about the program, the application. If you need clarity on anything, my contact information is on here as well. So feel free to jot that down again, and we'll send this out after tomorrow morning. But I will pause and see if there are any questions for anybody regarding the program or the application. Center-based programs eligible if they meet other requirements. Taylor, that's a great question. I will relay that back to Blue Cross and confirm that with them. I have your information from registration, and I will get back to you. So they're the ones who give the final approval on schools, and so I will ask them and get back to you. So I'm going to make a note just to make sure. Of course. Wonderful. Okay, everybody. Well, thank you so much. I know this is lots of information in 30 minutes or less, and so I appreciate you jumping on to join us this afternoon. Again, if you have any colleagues that would like to sign on or join, we have our second webinar tomorrow morning, bright and early at 7:15 a.m. But again, the slides and the presentation will be made available after tomorrow's webinar. Again, my contact information was on the slides. It'll be sent out to everybody. You'll be getting the information from me. And so if you have any follow-up questions, you'll be able just to respond directly to me if there is any follow-up that you have with me. Okay, so I'll hang out just for a minute or two if you have anything else that you'd like to chat about, but that's all we have on our end. So again, thank you so much for hopping on and joining us this afternoon. And again, we'll look forward to receiving your applications or just any emails that you have if you have any questions for us. So thank you, Rebecca, Crystal, Taylor, and Renee for joining us. And I look forward to hearing from everybody soon. Have a wonderful afternoon.